Hi, everyone. We're going to get started in just a minute, right at 10 for our quality assurance webinar. Thanks so much for joining. And we'll give folks that are coming in just another minute and then we'll get started. Okay, I think we will go ahead and get going. We are recording this webinar, so if you have colleagues who were hoping to join and weren't able to, no worries. We will send out a PDF of the PowerPoint from today's information, and then we will also upload a video of the full webinar, so folks can always go back and watch it later. So just to introduce ourselves, my name is Jennifer Duval. I lead the Kaleidoscope Play and Learn program here at Child Care Resources in Seattle, and I'm joined by my colleague.
Hi, I'm Kimberly. I'm a family engagement specialist at Child Care Resources.
Yeah, so this is not what we consider our most exciting and tantalizing of webinar contents, but it is really important content, and it is a great chance for us to kind of talk about what our quality assurance measures are, and then have you ask questions or get clarity on why we do what we do, how we do it, what the expectations are for all of you as affiliates, and any details on any of these forms that we have that you want to get clarified. This is the time. But know that we're also always here to help answer questions as they come up when you're out in the field doing the amazing work that you all do. So the three big components of quality assurance that we do for Kaleidoscope Play and Learn are the Caregiver Survey. It's also known as the Caregiver Feedback Form. And we'll be spending a good part of this morning's webinar talking about that, what the expectations are for all of you as facilitators, and then what that means for the participants of your group. So one is the Caregiver Survey. There's also the Quality Self-Assessment Form, or QSA. And we'll have a chance to talk about that a little bit. Know that that is not expected or due here at CCR until the end of the calendar year. So you definitely have time on that one, but it's a good chance to just get any questions answered and go through kind of basically why we do it and what it looks like. And then we're going to dig a little deeper into the monthly attendance reports. This is something that seems really basic. We know that you all are taking attendance at your groups each week, but because of changes in the forms and just everybody doing things a little bit differently, we're hoping to get any questions answered about how you fill out, how participants fill out their sign-in sheets, and then how you fill out that monthly attendance reports. And this may be you as the facilitator doing it, or maybe your coordinator does it, or somebody else at your organization. So as clear as we can get on how to accurately complete those attendance reports, I think that will just save everybody a lot of aggravation, and we want to make it as simple and clear for all of you as possible. We are honestly not trying to create extra work. We want to make it as easy for you as possible. So we've made a couple of changes to the forms for 2019, and we're going to go through those in detail. And as always, please do ask any questions about it. And the other thing just to remember, if you have been doing this for a while and you have tips for other facilitators or coordinators on things that have worked for you with some of this quality assurance, please feel free to chime in. You can either unmute yourself, or you can go ahead and type into the chat bar or raise your hand. We get a little notification if you type into the chat, and we can go ahead and unmute you on our end, and we can read out your question, whatever you're more comfortable with. So we will go ahead and dive in. The first thing that's really helpful, I think, to think about is, why do we do quality assurance? And part of the reasoning is for us as kind of the holders of the Kaleidoscope Play and Learn program at Child Care Resources, but it's also for the communities that we work with and serve. So when we're looking at this data, we're trying to figure out, are we actually achieving the outcomes and working towards the bigger goal of supporting families and helping all children be ready for school and life? That's really part of our model. And so are we doing that in the programs that we're running? And this is a way of kind of measuring that and seeing that. And then at the same time, it gives us a chance to look at the programs and see what changes can we make, how can we improve them. And Kaleidoscope has an amazing history of being very adaptive to the needs of different communities, different groups, the groups over time. So we want to keep, we don't need to stay static and have things be the exact same year after year. We want to keep learning and growing. And all of you who are doing this work day in and day out on the field can give us amazing insight and information on, okay, what's working, what's not, how do we continue to improve our models. And then for groups that are running across the state and across the country, how can we be sure that they're maintaining fidelity to the KPNL model? So what is a way of saying, okay, we know there's great flexibility in this program, but there is a need for fidelity to the basic model, and what are some ways that we can make sure that that's happening consistently across the board? And then a really big reason for doing evaluation and quality assurance is that we want a way to tell others, particularly funders or stakeholders, community members, we want a way to tell them that KPNL is effective. And the best way to do that is to have evidence to show that this program truly is worthy of funding and inclusion in policies and strategies. So by having this data, it really makes a difference when we're trying to share out this information with funders, with the government, with stakeholders, even just others within your organization. If you have data behind why you think families are benefiting from KPNL, it's going to be much more effective. So do folks have any questions or comments or ideas about that before we move on? Okay, then we will dive right into the survey process. So this is for those caregiver surveys that I mentioned. And this timeline is specific to our affiliates in the state of Washington. So I'm going to go through this knowing that for all of our Washington folks, this is the timeline that we're shooting for. If you are running Kaleidoscope Play and Learn groups outside of Washington, you have a lot more flexibility in the timeline. Just know that you'd be submitting that annual reporting form by the end of the year. So you can choose kind of your survey period, but you'd be submitting your data by the end of the year. For our Washington state affiliates, our caregiver survey process is coming right up. So at this point, what we would love for you to do is to look at your calendars and look at your group schedule and choose a 2-week period in either April or May where you're going to be collecting surveys from the participants in your group. So our official survey collection time, the window opens April 1st and goes through May 31st. And so you are going to pick 2 weeks in which to do those surveys. And remember, you don't have to, if anyone who's come to your group has filled it out 1 week, they don't have to complete another one the second week. The reason we do a 2-week period is because we know that, you may not have the exact same families participating both, in a 2-week window, and we're trying to get as much data as possible. So you would have, for instance, if you were had a group on a Wednesday, that first week you would ask all of your participants to complete the survey, and then the second week you would say, for anyone who wasn't here last week or didn't get a chance to complete the survey, let's go ahead and have you complete it in that second week. And we'll talk more about how to choose your window and how to actually do the surveys with folks, but this is the general timeline. And then you would gather all of that information, make a copy of all the surveys. We've had actually a couple of times over the last decade or so, there have been surveys that have gotten lost in the mail. So it would be we really, really encourage you to make a copy for yourself, just in case. And then you can either mail them into us at Child Care Resources, or you can scan the forms and email them in, and save on postage and the risk of anything getting lost in the mail. So if you have feasibility to do that, that's even better. And there is a cover sheet that goes with the surveys that has, the email address to mail it to, the mailing address if you're going to be mailing it, and there is also a direct fax line to our amazing coordinator, Wisteria Oliver. And so if you have to fax it and you want it to go directly to Wisteria, there's an option for that as well. And then after that, that by the end of June, we should have all of the surveys from all of our Washington affiliates. And then we will actually enter all of that data. We do that here at Child Care Resources. And then in the late fall, we get all of those, once they're all entered, we get those to our consultant partner, ORS, and they will create those amazing reports, the annual evaluation reports that you've seen. So those would be ready next January 2020. We always post the overall evaluation report on our website. We send it out to all affiliates, and then we can also work with you on your individual reports for the data that you've sent to us. So any questions about the timeline, or if anybody knows already that they have any kind of issue with that timeline, please do reach out to us. We can certainly work with you on making sure that if we have data, if we're expecting you to be sending in that data, figuring out how we can make the process smooth. Okay, then we'll move on to some details about the survey. So you're going to want to choose that 2-week period in April or May, where you'll hopefully have the most participants coming to the group, and where you feel like your group is ready to actually complete the surveys. And you can plan a time during your group, either when folks are first coming in, or maybe at the end if they can stay a bit later, or maybe while it is child-directed playtime and that participants of the group could have a clipboard and be filling out the survey as they're kind of following their children around. So you'll know best what is the best, most convenient time during the group. But that's something to think about. And I do want to pause for just a minute because we have a couple of chats and questions. Oh, so Monica was asking about the annual reporting form. And Monica, you're probably not as familiar with that because you know all the Washington forms, and that's actually something that our out-of-state affiliates complete because they are not required to send us all of the data that we get from our Washington affiliates. So that is more for folks who are participating in other states. Thank you for asking. And then just to be mindful about having all of your supplies ready. So we will be sending you the updated 2019 form. So you'll make, whatever number of copies you feel would be best for your group, and have pens and, make it as easy as possible for participants to complete them. And then if it would be helpful, to maybe have extra staff members from your organization to help complete the forms. If you are within King County, we also have capacity to go and help complete the surveys. I always, I feel bad for our many affiliates who aren't in King County, and this is less feasible, but know that we, as the family engagement specialists, we're able to come on site and help facilitate getting those caregiver surveys completed, if that would be helpful for you. And folks have done that in the past over the last couple of years and found it to be very, very helpful. Sometimes just having an extra person there to kind of explain why we do the surveys and what they mean and what we do with them, and even just to have an extra person to help maybe keep an eye on what's going on in the group and be an extra pair of hands so that the caregivers can focus on doing the surveys. It can be very, very helpful. And we like to recommend that you bring a copy of the 2018 evaluation report so that families know what we do with this information and what it turns into. So that's been sent out to everyone. It's also up on the Child Care Resources website. If you have any difficulty accessing it, please just shoot us an email and we can send you a PDF copy of the 2018 report, because that wouldn't happen if it weren't for all of you providing this information. So, as you're helping participants to fill out the form, remember that there is a full script included with the instructions for the caregiver survey. And so, feel free to use that and adapt it to kind of give some background on why we're asking for this information and what we do with it. So, feel free to use that and let caregivers who maybe haven't done the survey in previous years, who don't know, what we're doing with this information. There's a script that really has great detail about the questions that you might get asked and how best to answer them. And so it's always good also to remind them that these surveys really are to evaluate how the program is going. It's not in any way to evaluate, the caregivers or the children or the facilitator. There's no judgment on anybody who's there at the group. It's all about, is the Kaleidoscope Play and Learn program doing what we hope it's doing? So that's why we do the surveys, and we don't want folks to feel in any way intimidated or like they're being evaluated, because it's not a personal thing. And of course, we don't track anybody's personal answers. It's completely anonymous. Their surveys are totally confidential. So always good to remind folks of that. And then as facilitators or coordinators, you can always offer to help with reading the surveys, with answering questions if there's anything that's unclear, with translating if you're able. We do have the surveys translated into multiple languages, and we'll talk about that a little bit. But if that's something that somebody needs additional help with, if you're able to do that, wonderful. If you need other help, please do let us know. And doing these surveys is voluntary, so we would never say that a participant coming to a group on the day that surveys are being done would absolutely have to do them, or but we really hope that you're encouraging the caregivers to complete the surveys and making that as feasible for them as possible, because this data is so important. And so we rely on all of you as having the relationships with the participants in your group to really help explain why they're important and have those surveys completed. Then what happens to the surveys after you've done your part and you've mailed them in to us? So a reminder to have the cover sheet that goes with them. We get a lot of data. Last year, we collected over 900 caregiver surveys. So we have great systems in place here at CCR for tracking and managing all of that data, but it's really important that we try to stick with these the timelines, and that you fill out a cover sheet so that we have, there's no question as to whose data it is. And so if you could either scan them and email them in or mail them in by that June 30th deadline, that would be great. And believe it or not, we do enter them all by hand. So this is a huge undertaking, and that's why we're trying to keep with these timelines. So we have an amazing team here at CCR that does the data entry. And then once that's all entered, we work with ORS Impact to go ahead and analyze the data and talk with them about any trends and changes, and what might be most impactful to have included in the evaluation report. And then they get that to us by the beginning of January, and we can share it with all of you. And then again, if your organization receives individualized reports, we can work with you in January to get that too, which is great for our affiliates who want to share that with their own, maybe with their board, with their organization, with their funders. You've got this, a great evaluation report of the previous year to use for other funding. So just a reminder, every year the surveys do get edited and changed a little bit. So please be sure that you're completing the 2019 survey. And it'll say 2019 up at the beginning of the top of the form, and then also in the footer at the bottom of the form. So please, just check that as you're handing out the surveys. And then know that they're available in English, Chinese, Somali, Spanish, and Vietnamese. We've had them all professionally translated and then checked by native speakers to be sure that they were accurately translated. So we do have the forms in other languages. Please let us know whichever ones you need. And And again, just be sure that you're working off of the 2019 version. So we're going to go through, well, actually, I'm just going to take a minute. Does anybody have any questions yet before we dive into the actual 2019 caregiver survey form? Okay, great. I feel like this is not, I hope you're still awake and with me because this is all, paperwork stuff, but as I said, it is really important information that we gather. So, and if there are any, if you've had any questions about particular items in the survey in the past, this is a great time to get those answered. So the 2019 caregiver survey or caregiver feedback form doesn't have a whole lot of changes. I've highlighted the ones, places where it's different from last year. So just to point out a couple of things, it'll have the new date, and then you will be handing this out to all of the participants and asking them, we are not collecting their names or any personal information, but we are asking who they bring to the Play and Learn group. And so they'd be completing that. And then we really would love to know the ages of those children. And we've tried to make that kind of as clear, this question as clear as possible, because folks have had, there's been confusion, for instance, when families bring multiple children and they're of different ages, or maybe some children aren't theirs. We really want to know for any of the children that they're bringing to group what those ages are. So they would go through, each column filling out the age for each different child. And then we ask how many times they've attended the Play and Learn group. And we do look at this data as far as does the number of times that families have attended affect their answers and where they are on that continuum. So if they've only come one or two times, that we ask that they just skip to question 7 and get into those demographic questions. If they've come at least 3 times, then we would have them go on to some of these outcome questions. So you'll see here it's a scale of, we're asking families, for all of these items, is it about the same, a little more, or a lot more? And we really want them to answer, just one, to check just one box and to go through all of these. And this is a good time, maybe, when they're getting started, just to remind them that, this is not a personal evaluation. This is really about the model of Kaleidoscope, and is it helping to move the needle on some of these items. So we've got a chat here. Thank you, Jessica. So Jessica's asking for how many times they've attended. Are we wanting to know just for the year, or how many times in total? That's a great question. And if they have been coming for more than this, what you're considering this year, so since you last did it, let's look at just for this year. However, if they hadn't come, oh well, no, that wouldn't matter then if they'd come. So if they've come for the past 2 years, but they can kind of estimate, then they're going to go with it would just be a plus number, so it'd be over 36 times. So we're not asking them to count the exact number of times, but if they could just think of in the past year, that would be great. And then there are a couple of open-ended questions. So this is on the other side. The survey is 1 page, both double-sided. And so on the back side are these 2 questions, which are open-ended and which really give us amazing quotes and new information that we may not have thought to ask in some of the other questions. So if people are comfortable completing these questions, it's wonderful to get some of this information. So just asking the caregivers, what are 2 or 3 things that you do differently as either a parent or caregiver with the child in your care since participating in Play and Learn? And we love reading these responses. And then if you want to, please tell us about what skills your child has gained because of participating in Play and Learn. So, of course, one of the big things that we hear again and again is sharing, right? Because for many families, this may be the first time that they've brought their child into a group setting, and getting to see them with other children of their age and sharing, or maybe not sharing. It's a great way for families to kind of take a moment to think about, oh, what's changed since we've been coming to this weekly Play and Learn group. So if people are willing to complete those questions, that's great. And those are the same, the wording has not changed at all since last year. And then these last few questions are demographic questions. We've highlighted the changes in these, which are very, very minimal. So we first do ask about gender identity and then race identity. And then for languages, we had some confusion around languages. So we did change the wording a little bit and just wanted to point that out. So here in number 9, we're asking for participants to check just one box. So if they speak 2 or more languages equally at home, they would check that box. They don't need to check what those 2 languages are. We just are really wanting to know if there's 2 languages that are spoken equally. Otherwise, if there's one language that is spoken the most, then they would check that one box. And there are multiple options here, and they can also check the other box and write in what that one other language is. I hope that this makes things a little bit, easier and more clear for folks. But if you have questions about that, please let us know, because maybe people would ask you, if they're not sure, they don't understand, and just want to make sure that people understand that first box is really if there are 2 languages spoken equally, and otherwise we're looking for what is the most often used language by the adults in the home. And then the family income question gets updated every year. And so these are the new federal guidelines. So those are the new numbers that are put in there. And of course, all of these questions are optional. Some participants choose not to answer that, but just as a reminder, this information is confidential and anonymous. So we do ask them to complete that so that we know kind of what are the income brackets and that of families that are attending Play and Learn. And as you all know, we have a real focus on serving families who may not be accessing other resources and may have more systemic barriers, and income is absolutely one of those barriers. So we'd like to know, how many families identify as lower income, and that's why we ask that question. And then we've added a question that seems like a really important one that we would love to know more about. And we we talked with many community partners to see what's the best language wording to be able to ask this question. And we understand that it's a sensitive one, and so some folks may choose not to answer. Some folks might have questions about it, but we're asking this year, do you care for a child with developmental delays or any special health care needs? And families may say yes or no. Families might leave it blank. Some actually may be unsure. And so, in the future, we might even add an unknown or unsure box, because, for children, particularly children, under 5, families might have some concerns about this, but they may not have a diagnosis or any kind of definitive answer on that. So I think it's great information for us to get. We know that there are a lot of families who are really taking advantage of Kaleidoscope Play and Learn groups, and who are bringing children who do have some special needs. And we want to always be able to adapt our program so that it is welcoming to all. And this is one way that we can learn a little bit more about that. And then we also ask if caregivers are receiving payment from DSHS or Working Connections to provide childcare. So as I said, most of this is pretty much the same as last year. We've just made a few of these edits. If you ever have suggestions or questions or comments about the survey or the questions we ask or the data we're gathering, we would absolutely love to hear it. We know that many of you collect information from the families attending your groups that you need for your own organizations. That's above and beyond what Kaleidoscope requires. But this is our kind of once a year ask of gathering this data. And as I said before, we really rely on all of you to gather it. So any questions or comments about the survey? Okay, we've got one. Somebody's awake. Let's see. Alejandra, sorry, but what is DSHS? Oh, thank you for asking. It's the Department of Social and Health Services, and different states do that, might have different names for that. And this is something that through Child Care Resources, that because of some of where our funding comes from, we like to report out that information so that we know how many people are getting that particular funding, and that is tied to income level too. Okay, so we touched on this a little bit, but for you all as affiliates, kind of some reminders of why it's so important to do the surveys is first, you get back data for your own groups. So, this is really, it's amazing information for us, and it's also some great information for all of you from the caregivers that you're working with every week. And then you can take that information and share and brag about the results. We've had consistently positive results over a number of years. And so for you to be able to share that with, again, your funders, your board, your colleagues, your community partners, it's a great kind of handful of data that you can use in having conversations about your play and learn groups. And then it's also a way for caregivers and parents to share their feedback. If that's not something that you're doing regularly, gathering information from caregivers, this is at least a once a year opportunity to do that, and they can really give you feedback on how the groups are going. And by more and more affiliates collecting the surveys, it offers us a bigger data set for these surveys, which is always going to be more reliable, and it's more compelling when we're sharing this information with funders. So the more that we can get, of course, the better. We've got another, just a thank you. Okay, great. So as far as the caregiver surveys, your next steps, pretty simple. Have a look at your calendar and your group schedule for April and May and choose your 2-week survey period. Mark that on your calendar. You might want to share with your participants that that's going to be happening a little bit beforehand so that they know and can have any questions answered. You will have all of the forms, so you'll have a chance to look at the actual survey and then the instructions and the suggested script, so that you have time to ask any questions of us before you're out there doing it. And then please do call or email us if you have any questions about any of this. So for now, you would just be choosing your 2-week period, but April is going to be here absolutely before we know it. And so in April and May, you'll be actually collecting those surveys. And today's the first day of spring, so happy spring, everyone. So I have done a lot of talking. I'm going to take a pause and see if anybody has any questions, or if they even want to share what the survey process has been like for them in the past, or things that have been helpful for them when they've done it different ways, or anything that you'd like to share about completing these caregiver surveys. Or if you're even nervous, if it's your first time doing it and you have any hesitation or nervousness about it, this is a great opportunity to share with your colleagues. Okay, thank you, Monica. So Monica's got a question about that language question. So I'm just going to read it out. Sorry if I missed clarification on the language spoken at home. If they select 2 spoken languages equally, should they also select the 2 languages spoken? So actually that is a great question, because it almost seems like they should, but we just want them to check one box. And so if it's 2 languages spoken at home, they would just need to check the one box. So
that's a good question.
It is a good question. And of course, if they've checked that one box and then they do check 2 languages, we would know that they're saying, my 2 languages are English and Somali. They're spoken equally. But for our data entry, we need just one answer. And so we wouldn't be entering what those 2 languages are. We need to know just one, just that they speak 2 languages. I hope that makes sense.
Yeah, and unfortunately, if they check more than one box for that question, we cannot count that response anymore. So really try to encourage them to check one box if they can.
Yeah. And if you notice it on, if you are kind of reviewing surveys and you notice it with caregivers, then you can always mark a survey. You could, if they have done something, that's unclear or incorrect, you can check that just kind of put an X through it and circle and maybe put a note and let us know 2 languages spoken at home. So that's all that we're trying to gather from that is it 2 languages equally? So thanks for pointing that out, Monica. That continues to be kind of a confusing one. And then Fran has a great suggestion. Fran says, having a clipboard has helped and having extra staff. So just, yes, if you have clipboards that you can give so that families can be filling it out, even if it takes them the whole 90 minutes on and off throughout the group, if they have a clipboard and pens, that's great. Having an extra pair of hands is always great for this. And then Fran has a question. The language I want to know if they speak Spanish for other grants. So I think what you're asking, Fran, is you're wanting to know what those languages are, and if they speak predominantly Spanish at home, then they would check just Spanish. But what we were trying to say is if they speak 2 languages equally, then they would just check that one box.
2 or more languages.
Sorry. Yeah. And then Laura has a question. I'm in North Carolina. Will you be sending the survey to us? Yes, we will. Thank you. So for all of our out-of-state affiliates, we will be sending you the forms, and just know that you don't have to do it in April and May. You're more than welcome to, but you have actually a much bigger window for completing them if that works better for your organization. And then another question is from Emily, asking about amendments or additions to the caregiver survey from affiliates. Does anyone have an example of using annual KP&L data for affiliate outreach purposes? That's a great question. So have other affiliates, either in Washington or across the country, have you used this data for outreach purposes? Emily's looking for suggestions, it sounds like. We certainly use it all the time. We start sending our evaluation report to everyone we're communicating with once we have it as we're doing outreach. But do other affiliates have specific examples of how they've used it for outreach purposes? I think the biggest one is probably for grant writing, that this could be an amendment or an attachment in applying for continued funding or new funding. But perhaps others have used it for other things as well. Well, if anybody does think of anything or anything that they want to share on that front, feel free to type it in, and we'll share with the group. Thanks for that, for those suggestions and questions. That's exactly why we're here this morning.
Such good questions.
Yeah. Okay, we're going to talk just briefly about the quality self-assessment. As I mentioned before, we're not going to collect these until the end of the year, so you do have time. But just kind of to review again why we do the quality self-assessment and what that looks like. So before we get into that, I see we do have one more chat. Oh, Fran says that recruitment to talk with DSHS or other offices to say what a family might gain from the group. So yeah, just taking some of those bullets of what are some of the outcomes that families might experience from participation. That could be great for talking with other agencies about why these groups are beneficial and what families might get from participating. That's a great way to use it. So the QSAs ensure that the group is following the Kaleidoscope Play and Learn guidelines. It really kind of walks through some of those guidelines and allows for reflection on how the program is going, how the facilitator is feeling about the group. And so it ensures that at least once a year, folks are taking the time to really look at this. And so we do have, a standardized form that you can do for this. And most of you have probably completed this in the past. Many, some maybe have not. This is something that you will do either, as a facilitator, if you have a coordinator or supervisor who is familiar with your group and your work and is able to do this with you, that's great. There are some facilitators who kind of are out there doing their groups every week on their own, and they might complete the QSA on their own. But even if that's happening, then it should be a really intentional time of thinking about how the group is going. And taking some time to reflect, and then filling out that form so that you can think about what's going well in the group, what are some challenges the group might be having, what improvements could be made, and filling out that form as honestly as possible, going through kind of thinking about, like, are the guidelines all being met. And then it's a great idea to go ahead and make a plan for the coming year. So things that you've noticed that are things that you're working on or that you might want to adjust or improve, to really come up with a plan for how that's going to happen. And that might be great information for you to share with a supervisor or manager or coordinator, to say, this is something that I've noticed, I've taken some time to really evaluate how my group is going, and this is one particular item or issue within our weekly group that keeps coming up, and I'd like to make some improvements, and these are some ideas that I have. If you have completed this form and have that kind of laid out, that's great information to share so that you can get some support in making those adjustments. And then you would keep a copy and you would send us a copy, but to be able to go back and look at that QSA and note any progress that you've made towards these goals or any challenges that you're still having. So do folks have any questions about why we do the QSA, or how you might do that? Does it seem like something that is challenging to do as a facilitator? Maybe, I'm wondering if folks get support from their coordinators or supervisors to do this, because it does take a little bit of time and reflection, but it really is a valuable exercise, I think, both for the affiliates completing them, and then also for us at CCR to see how folks are doing and how we might better support you. So we have a question from Emily. So it is per each facilitator's performance implementation, not per group. Correct. So it would be, so if one facilitator facilitates 3 groups, then they would just complete it once, but they could make notes about any differences within the different groups. So the groups might happen in 3 different spaces, and there might be an issue with space in one of the groups, so that could be listed. And this is very flexible, in that if you had a facilitator who was, for instance, facilitating 2 different groups in 2 different places with 2 very different populations, and they felt like, this is completely different, I feel this way about this group and this way about that group, they are more than welcome to do 2 different QSAs. I think that would be completely appropriate, and that folks do that. And know that for our Washington affiliates, we read closely through all of those QSAs and then offer ongoing technical support. For our out-of-state affiliates, we ask for the coordinators to really go through those QSAs, and then they're going to kind of look at trends and concerns, any longer-term goals, any notes, and they put that in that reporting form, and we can work with them on how best to support any kind of changes or improvements needed with their facilitators based on that annual reporting form. So we've got an example of, there's a small group with a few facilitators, we would send in QSAs for each facilitator. Yes, and the facilitators would take part in that. So they, it's not just a kind of a review by the supervisor, it's really a joint process with the facilitators. So encouraging them to see it as a time for reflection. And so each facilitator is going to reflect on the group, even if they're attending the same group, in a little bit of a different way. And you want to know, how that individual facilitator is feeling about the group. So great questions to clarify. So we just ask for these once a year. And as I said, it is for each facilitator. And again, yes, if a facilitator facilitates multiple groups, they can do just one, or they can do one for each individual group. It's really up to facilitators and supervisors. And then just again for timeline, these are not due to Child Care Resources until the end of the year. So, but it used to be that we asked for them at the same time as the caregiver surveys, because I think we thought perhaps it'd be easier for our affiliates to think of doing all the paperwork at the same time. I'm not sure that's the case. Doing the caregiver surveys as these groups, there are more and more groups and more families attending. That's kind of a big lift to get all of the caregiver surveys. So we wanted to allow some leeway and say, if you want to get the surveys done and then do the QSAs later in the year, that's absolutely fine. So it's really at your discretion, what makes the most sense for your organization. And let's see. Yeah, so just a reminder again, want to clarify for the out of state that you are not going to be sending us all of the individual quality self-assessments. That will be worked out with your coordinator, and then you would send the annual reporting form. But for all of our Washington affiliates, we are asking for QSAs for all facilitators. Any other questions before we move on to the next section of quality assurance? Oh, one more slide about self-assessment. So we're really trying to sell this of why it's important to do all of this data collection. But it is, we see this as a chance to really reflect on all the things that are going great in the group. And for facilitators to help build on what's going well and see, what are some things that they can do to maybe make it an even better experience for the families who are participating. And we do get asked time and time again from funders, from other agencies, that what do you do as far as quality assurance? And by having facilitators and coordinators reflect on the group and its progress and its, the current situation of how closely it adheres to the guidelines, by doing this at least once a year, this is great information for funders, for your board, for staff, even for new families that are joining and for the families that you've been serving. It lets them know that you're regularly evaluating and improving upon the program. So it's not a static thing that is just going to look the same, week after week, month after month, year after year. We're continuing to take time to look at it and see what's working and what's not, and make any necessary adjustments. I mean, that is the beauty of Kaleidoscope, that there is great flexibility. But if you never are able to take the time to really look at it and see, these are the guidelines, how am I, meeting each of them, and what kind of support do I need if I feel like I'm a little bit further than I want to be, then we wouldn't continue to improve. So it's really important to take this time. It's only once a year. We're happy to help if needed, but to really take this time to reflect on how the group's going and what adjustments or improvements could be made, if any. So before we move on to the next one, which Kim is going to dive into, any questions on anything we've talked about so far? Anything unclear, anything that folks are concerned about in collecting all of this quality assurance information? Okay, I guess you're all with us. So,
monthly attendance reports. So at each Kaleidoscope Play and Learn group session, participants fill in a sign-in sheet at each one, and then every month, all of those sign-in sheets that were filled by them for that month, that information gets transferred to a monthly attendance report that has to be submitted. And these sign-in sheets don't need to be submitted, at least to Child Care Resources. All we need is a monthly attendance report. And if there is any other type of documentation that you use during this process, like an Excel sheet or a scratch paper or whatever it is, you do not need to submit those either. And we'll look at the monthly attendance report and the sign-in sheet more closely, but before we do, there are just a number of things that we want to talk about. The reason why we do this is to track the number of people participating. We want to be proud when we announce how many people we reach every month and every year, and we can't know that number if we don't do the attendance. Unduplicated numbers is something that can be a little bit confusing for people, and unduplicated numbers are what we use for attendance. And what that basically means is that we count a person one time for that month, no matter how many times they attended. So for example, if grandma comes every week for the month of March, she comes 4 times, she still only counts as one participant in the attendance. She does not count as 4 people. If you have any questions related to that, definitely let us know. You don't have to memorize the term unduplicated numbers. We don't need you to do that at all. We just need you to understand the concept of it so that when you are doing the attendance, you're counting and tracking the people accurately. So on the sign-in sheet and monthly attendance report, the categories that we categorize the adults in who attend Kaleidoscope can be confusing for some people. So we just want to go over that again. And there are a number of different categories we use. One of them is family, friend, and neighbor caregiver, or for short, FFN. And that's basically anyone that is bringing a child that is not a parent. So again, that's, for example, uncle, grandma, sibling, cousin, nanny, and so on. The exception for this is that if there is a licensed child care provider that brings the children in their program to Kaleidoscope, which does happen actually quite often, they would not count as FFN unless they bring their own child. Some other exceptions that we have include like a therapist, for example. Sometimes therapists come to groups to see the child that they're treating. They would not count as FFN. They would count, they would still count, they would just be noted in another column called other, and we'll go over and see what that looks like soon. So again, FFN, there's a column for that on the forms, and then in other, we would put licensed child care providers, therapists, and so on, or maybe a guest speaker you might have coming in to present to the group. And I think we have a question, so I'm just gonna check on that really quick. Or maybe it's a comment. So the question is, so if that grandma comes in January, February, and March, will she be counted for each month?
For that month, yes. So when you send it, because you'd be sending in your monthly reporting, and so we wouldn't see the week-to-week grandmas counted 4 times. She would just be counted once for January, and then she'd be counted once for February, and then once for March. So when we're collecting that monthly attendance, that's how that would look. Thanks for asking.
Yeah, that's a good question. Thank you. And I would say sometimes caregivers may ask, well, I came a really long time ago at some point, now I'm back again, and they're not quite sure am I new or returning. And I really would just leave it to the discretion of that caregiver and use your best judgment. We trust you that you can decide whether or not they're new or returning. So another category that we have is parent. So that is anyone who identifies as that child's parent who comes to Kaleidoscope. And then there's also the both category. So that is for folks who bring their own child and someone else's child. And then we also count the number of children, of course, from birth to age 6. And you also want to note that when you're submitting monthly attendance reports, that's a great time to inform about schedule changes, group changes, or anything about the group that you might want to share with us to update us on. Okay, so this is the monthly attendance report that I've been talking about. It's been slightly updated, very similar to the older version, and I understand that there have been many different types of versions of these forms. The reason why we decide to update it again is that we wanted to make sure that the monthly attendance report and the sign-in sheet were aligned and corresponded together really well to make sure that this process was as easy as possible. And there were some people who still have some challenges in filling these out, and we realized that it's because the forms are kind of confusing, so we've adapted them. We also have a question here. Do we count facilitators who are also parents? That's a good question. So there are some facilitators who come to a group and they bring their child with them. And in that case, then yes, I would say that it's totally fine that they mark themselves on the sign-in sheet. There are also some facilitators who don't bring their child with them to their group. And in that case, they would not need to indicate that they are FF and caregiver or a parent. The next question we have, just to confirm, this is for out-of-state affiliates also.
So out-of-state affiliates are welcome to use the sign-in sheet that we've given as an example, but we are not actually collecting the monthly attendance from individual affiliates out of Washington right now. You would just track that information for your own organization and then give us the summary at the end of the year.
Mm-hmm. Thank you. Those are good questions. Oh, and we have another question coming in. Do you need to know who is new and returning on these reports? Yes, we do. And so we'll go over that in just a moment. So the categories I just talked about, children, parents, FFN, caregivers, those who are both, and other, which include a licensed child care provider or a guest or a therapist, are all here in this table. And I just want to also add in for the other column, we have here noted, this is where you would indicate children who are the age of 7 or older. And that's because Kaleidoscope is a program for birth to 6. And so we want to count, all the children that are coming, but we just want to make sure that we're tracking them properly. So like for in the summertime, for example, a lot of siblings come to groups because school is out of session, and a lot of children who are older, 7 and up come. This would be where you would note them. And you notice on the left, we have new this month and returning, and these are 2 separate rows. And this is where you would indicate who of these people are new that month or returning. So that is a required piece of information that we need. And this is the sign-in sheet I'm about to show you next that has been updated, that corresponds and just aligns really well with our new monthly attendance form. It uses the same words and it has the same organization and flow. This is what it looks like. In the red is an example of how it would be filled out at a group. And I'll just give you all a moment to kind of look at it. I just want to note also that this is not a required version of the form that you have to use. You can use any form that you would like. You could take this and edit it. You can use your own that you have. We just wanted to offer one that worked really well with the monthly attendance report that captures all of the information that you need to fill out the monthly attendance report. So just to make sure that that's clear, it looks like we have another comment or question. So Monica is asking for returning, is that for the current month only, or if they previously attended some time ago and came again?
If they've ever come before, because we need to look at from month to month. If there are folks who came the previous month, we don't, that gets back to your question, Monica, about would we be filling it out the same one person for January, the same one for February? By filling it out, if they're returning, then we're able to see who are the new families coming versus if somebody's coming for the first time. Wisteria, if you want to speak to that at all, of how, because Wisteria does the magic on the other end of entering all of this data and making sure that the numbers match up with who are new and who are returning. So she may have other insight on that. But when you are asking for, in the sign-in sheet, if families have ever come, you're wondering, is this my first time at Play and Learn? Not, is this my first time in February coming to Play and Learn? So yeah, she made it nice and simple. If they're returning, if they've ever come before.
Can you guys hear me?
Oh, yes.
Hi. So I guess if they had, they had a young child 10 years ago and they were coming to Play and Learn, Kaleidoscope Play and Learn regularly, and then they didn't come for 7 years until their next child was born, maybe then they could count themselves as new because it's been, years upon years. But generally, yeah, if they've ever been before, then they're going to be counted as returning. And then on our end with our methods that we use at Child Care Resources and with our software that we have, we can figure out unduplicated across a span of several months, as long as people are accurately reporting if they are returning or new.
Great, thank you.
And it looks like we have another question asking for clarification if it applies to the different sessions too. So correct me if this is not right, but I think the question is asking, what if a participant goes to different Kaleidoscope Play and Learn groups, let's say throughout the week, and then they find another one in the area and they go to that specific one for the first time? Are they considered new, or are they considered returning? And that's a really good question. And Wisteria, please correct me if I'm wrong, but if they are new to that specific group, I think it'd be okay that they would mark themselves as, yes, I am new to this specific group, even though they attend other Kaleidoscope Play and Learn groups in that area, and they're returning participants for those groups. And it gets a little bit confusing because there are folks that do go to many groups, and some are Kaleidoscope and some aren't, because there are other play groups that exist out there. So that's something you might want to clarify with them either. And just to note that this system isn't 100% perfect or clean because of all the groups we have out there and whatnot, but this is at the moment the best we can do. And in the future, this may be refined, but for right now,
and part of why we do that is because if a caregiver went to a group that was with one affiliate organization on Tuesdays and then went to another group with a different affiliate organization on Fridays, we really want those two affiliate organizations to be able to count that family as one of their participants.
Yeah.
So they are going to be using those numbers even though it's the same family. And we, as Wisteria said, we do the best we can with figuring out how many are new and not returning. So it's not an exact science, but that's part of why we do it that way, because we know that these numbers are being counted by affiliate organizations because all of you are having to report on your attendance numbers to your funders as well. So that family would be counted at both of those different groups.
That's a really, really good question. Thank you. Okay, I'm just watching the time. Oh, let's see. Yeah, okay. So I'm gonna continue moving along. I wanted to show you all this slide. Hopefully it's not too overwhelming. So what we've done is the top table is from the example sign-in sheet we just showed you, and the bottom table is taken from the monthly attendance report. So every month the information from the sign-in sheet at the top table is transferred to this bottom table. And I wanted to go over a little bit what this looks like. So the names of the participants and the specific dates they attended, I kind of put X's on them because that information we don't need for the monthly attendance report. As for the date, the only thing we need related to the date is the month, that month, but we don't need the specific, the 7th or the 21st or whatever that participant attended. So we don't need that information. The only information we need is actually in the middle that you see in the colored boxes. And as you can see, the flow and organization of the tables, they align with one another, and hopefully this will make it much easier for you all to fill out. So for example, if you look at the bottom table and it's asking for new and returning those rows, you would look to the purple table up above to find that information. For the blue boxes, that's where you would look to count the number of children and indicate that. For the yellow boxes, the number of parents. For the green box, the number of family, friend, and neighbor caregiver. So basically anyone that is not a parent, with the exception of licensed child care providers, any guests you may have, therapists, and children over the age of 7. And then you can see that on the bottom table, there's this box that's yellow and green. And that column is asking for who are both family, friend, and neighbor caregivers, and parents. So to find that out, you would go to the yellow and green boxes above and see who marked both of those columns. And then the last column, the red, as we already talked about, are the other folks who don't fit in the categories before it. And we want everyone counts. We want to count everyone, definitely count everyone. We just want to make sure that they're tracked in the best way possible. That makes it easier for everyone to track who is coming and use the data efficiently. So hopefully this is helpful. Let us know if these forms work well for you at all, and please give us feedback. The reason why we constantly refine it is that we get feedback from the community saying, you know, this doesn't really make sense, or this needs to be changed, and that's why we keep changing it, because we want to keep improving it so it's most useful for all of you. Are there any questions about this? Sometimes this is the part that a lot of people find challenging. I will also note that the sign-in sheets and who manages the sign-in sheet, like the facilitator, for example, may not be the same person who fills out the monthly attendance report. And I think that's where a lot of the challenges lay. And so knowing that when the sign-in sheet is filled out really well and is clear and organized, and it makes it so much easier for the person filling out the monthly attendance report to fill it in, especially if those people are different people. So definitely keep that in mind. And then I think one more thing I'd like to add as well is in the table on the bottom that is taken from the monthly attendance report, all we need per box is a number. So 1, 5, 17, whatever it is. Anything else that you want to express about your group or communicate about your group can go like in the email that you send, in the body of the email, or in a separate document if you're mailing it or whatever it is. But all we need is a number in those boxes. Stories, narratives, explanations, and so on can go in a different space.
And we love to get those.
We do. We love it.
We
Please,
love it, yeah.
please give it to us. Just know that you don't have to fit it into a tiny box at all.
Exactly.
Okay. So we have another question or comment. Yes, someone has just noted that the Kaleidoscope planner and sign-in sheets that we're showing you right now make it a lot easier to collect the information that is needed. And that's definitely true. We played around with this table quite a lot to try to find a way to capture all this information in the best way possible. And we really feel that the one that we're showing you now is really effective in doing that. So yeah.
And for our Washington State affiliates who complete the attendance, sending in the attendance report each month, Wisteria will send out a reminder to all of you with that month's blank attendance sheet attached. So you'd be getting that at the end of the month to collect for the previous month. Mm-hmm. And you can always email her back with any questions or concerns you have. And we are having the revised sign-in sheet translated into at least Spanish for now, and hopefully other languages soon. We just want to make sure that it works for everyone and get a little bit of feedback from you all that are using it month to month, and then we'll make them available in multiple languages as well.
All right, do we have any questions, thoughts about monthly attendance, or just anything really about all of this? And Wisteria, I just want to note that people outside of King County and Washington State may have regional coordinators that they submit their attendance to every month, and that's very true. So just to clarify that confusion, if you're confused about who to send your monthly attendance reports to, you may fall in a region of the state where there is a specific person in that area that you would send it to. And then there are also some folks that would send it to us in Wisteria. So if you have any questions about that, or you're confused, let us know and we can help clarify that individually with you.
We really do want to make the system as painless as possible for all of you. So if you do have tips or suggestions, we'd love to hear them. As Kim said, we're constantly kind of refining and trying to improve the system. So we love to see these numbers. They mean a lot when we're talking about the program and showing all the families that are participating in and benefiting from attending Play and Learn groups. So having these numbers makes us really proud, and should make all of you feel really proud. And so this is the best way we've found for now of gathering that information.
Does anyone want to share any maybe tips that they have? Or I know depending on the affiliate, there are so many different ways people process the sign-in sheets and monthly attendance reports, and some people have tips and tricks. If not, that's okay, but to make sure people have a space to share if they would like. All right. Well, if not, where is our contact information?
Yeah. So if you
let
have
us
any
know.
questions about any of these quality assurance methods that we use, or need any support with any of it, please reach out to any of us, and we will answer your questions as best we can. So thank you all so much for participating today. Again, we will send out a PDF of this PowerPoint, and we will also let you know when the link is uploaded. So if there are others who wanted to go ahead and watch the video, they can do that at their leisure. And looks like we have one more comment. Just a thank you. So that's great. Yeah, I hope this was helpful for folks. We do this, every year when we're starting the whole new survey process, but that's not the only time of year that you can ask us questions about any of this. So please know we're here and available, and reach out if any of it was not clear. But in the meantime, you'll all be getting new forms soon, and let us know how your data collection goes. Thank you so much, everyone.
Thank you.